my name is Faith Jordan. Student ID is 3630837, and I will be showing you machine maintenance on our refractometer for Clinical Pathology 1 spring semester of 2024. And the things you'll need are room temperature distilled water, Clin wipes, an alcohol prep pad, and of course your refractometer. So distilled water, you'll need your calibration piece as well. This should be done daily or weekly depending on your use of your refractometer. Distilled water doesn't have a specific gravity, so it should read 1.000 on the specific gravity scale. And if it does not, that means your refractometer needs to be calibrated and then not used until it is calibrated correctly. So what I'm going to do is I will take this and I'll pull back the prism glass cover and I'll place a drop of distilled water on the prism glass. And then I will put that cover back on, then hold it up to a bright light and make sure that it reads 1.000 on the specific gravity scale. If it does not, I will take this black piece off here and the calibration tool that goes in with it. And while I hold it up to this light, I'm going to twist the tool until that light dark deviation reads 1.0 on the specific gravity scale. And now it does. And then I will clean it. I'll put the black cover piece back on, pull that glass cover back, take a alcohol prep pad, should be cleaned after every use like this. Clean off the prism glass and the cover, and then a Clin wipe to dry it. And we use Clin wipes so we don't scratch the glass or damage it. And now our refractometer has been calibrated for the week, so it goes back in the carrier. And that is it. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be showing you guys how to do a peripheral blood draw on a dog using his cephalic vein. His name is going to be Miller, and this is his proof of rabies. And this is for the spring semester of Clinical Pathology 1. So, again, we're going to be showing you how to do that cephalic blood draw on a dog. So let me get everything in position here. All right, there's Miller. And first we're going to go over the supplies that we need. So I have got alcohol swabs, clippers, a sterile 6cc syringe, and a sterile 22 gauge needle, and then my blood collection tubes. So first things first, I'm going to shave where I'll be drawing blood from on his front leg here. And if you know anything about shaving labs, you know how stubborn their hair pattern can be to shave. All right. I'm going to wipe the area down now with alcohol to clean the area and then make that vein kind of pop a little more. So I have got my alcohol pads here. So I'm just going to wipe the area down. All right. Got my blood collection tubes nearby with his name and species on them. And then now I'm going to put together my sterile syringe and needle. All right, so I'm going to insert this into his cephalic vein at about a 30-degree angle with the bevel side of the needle facing me. So a needle has a small hole, and that will need to face up towards you as you insert the needle. So my restrainer is going to occlude or hold off his cephalic vein right at the elbow joint there, and hold in and then roll out. And I'm going to place my thumb along that vein to help stabilize it. And take that off. All right, so once again, that bevel is going to face up towards me. Going to stabilize the vein. Going to insert at about that 30-degree angle. Pull back on the plunger. And then she's going to stop occluding. I'm going to hold pressure as I remove the needle for hemostasis to occur or blood clotting, and I recap like that. She's going to set him back down there. But that is how you do a blood draw on a peripheral vein. And then I will fill my tubes by taking these off, the caps off. And I will do serum separator first. This can hold 5 cc's. I don't need 5 cc's for the test that we are running. And then EDTA tube will be second. And I rock them gently, and that is it. My name is Faith Jordan. Student ID is 3630837, and I am going to be showing you how to do a blood film or smear today for Clinical Pathology 1 spring semester of 2024. And again, I'm going to show you how to do that blood smear or film. So this is something that should be done regardless if you use a automated hematology analyzer. We want to do this to prepare for our microscopic exam of that differential white blood cell count, estimate platelets, and look at the morphology of those cells, which is something those analyzers, automated analyzers, won't be able to pick up on. So it just aids as a better diagnostic tool to have that extra set of eyes on. So I've got a couple slides here with my patient's name, date, species, written towards the frosted edge of my microscope slide. I'll place a drop of blood from an EDTA tube towards the frosted edge of the slide, and I will take my spreader slide at about a 30-degree angle. I'll pull back to the edge of the blood. It'll spread across the slide here, and in one swift, steady, even motion, I'll push that forward, creating that even blood film across the slide. It should cover about 3/4 of the way. You want a nice feathered edge towards the end of it. So I will show you how to do that. So I've got my EDTA tube here with my pipette. And I'm going to place my drop of blood. So I'm going to come back at about a 30-degree angle, and it should end up looking like that. I'll do one more, and I'll flip that cover slide over so that the blood I just used doesn't transfer to this. So I flipped this over already. I'm going to come back, forward, much better. So that film, I'll hold it up towards the light here. It covers 3/4 of the glass. It's got a nice feathered edge, and then we will let this air dry completely. So I'll wait it to air dry, do this in order to stain it properly. So this has to be dry completely in order to stain and get it ready for our microscopic exam. 3/7, and I will be showing you the staining portion of making our blood film to do our differential white blood cell count for Clinical Pathology 1 spring semester of 2024. So I will be using a 3-step diff quick staining process. You'll also need distilled water, and then your gloves and your completely air dried blood film. So I'll talk you through the process and then I'll do it. So you'll start with the first one, which is the fixative, and that is 95% methanol. It'll sit in there for 60 seconds, come out, rinse it with distilled water, go on to the second stain, which is eosin, and that is buffered to an acidic pH. So it will stain the basic components of a cell like hemoglobin or eosinophilic granules. And it will stay in there for about 30 seconds. We'll come out, rinse it with distilled water, and then we'll put it onto the last stain, which is methylene blue. Again, it'll stay in there for 30 seconds. And methylene blue is buffered to an alkaline pH, so that will stain the acidic portion of the cells. So showing us things like leukocytes nuclei, which are also known as white blood cells nuclei. So I'm gonna take my stain here, my slide, and I'm going to place it into the fixative for 60 seconds. All right, so I'm gonna take it out and delicately rinse it with some distilled water. All right, now we're gonna go into the eosin for 30 seconds. And now we're going to go into the methylene blue for 30 seconds. All right, just doing the final rinse here. All right, now we're going to allow that to air dry until we're ready for our microscopic examinations. Faith Jordan, student ID is 3630837. And today I'll be showing you, demonstrating how to do the differential white blood cell count manual CBC for Clinical Pathology 1, spring semester 2024. So first we're going to start out by just evaluating the overall blood film, looking for any abnormalities, platelet clumping, microflaria, and we'll start with that. So turn my microscope on, and I'm going to start on 10 times and do that overall evaluation. So okay, so now that I've evaluated my slide for any abnormalities in the cells morphologically, so how they look, or any blood parasites, like microflaria, and I didn't see any abnormalities. Now I'm going to look for and identify the monolayer. So a blood film has 3 components to it. You have the body, which is up by the drop, and that is typically going to be the bulk of the cells, so they'll be stacked on top of each other, not great to identify anything. And then you'll move into the monolayer, which is going to be best for doing your film review, doing that differential count or the counting area, where all the cells are laid out smoothly. And then up to the feathered edge, you'll see everything is kind of broken up. You might see more abnormalities towards the edge, but you want to identify the monolayer because that is going to be your counting area. So for me, I like to, it's easiest for me to identify the monolayer rather than working from the body forward. I like to start at the feathered edge and work back onto the body so I can identify that monolayer to start doing my count. So I'm gonna go all the way to the feathered edge. I'm gonna go back to 10 times, and I'm gonna identify that monolayer. Okay, so now that I've identified where my monolayer is, I can start counting. So I have got my manual white blood cell counter here. And as you can see, it's got neutrophils, lymphocytes, eosinophils, basophils, monocytes, segmented, banded. And so this will ding when it hits 100, because you want to count 100 white blood cells total. And whatever those numbers are going to be recorded as a percentage. So in order to do that, you're going to end up on 100 times, which is your immersion oil. And I like to wipe it off with a Clin wipe before I use it. I'm going to place a small drop of oil there. And move it over since I'm right-handed. And begin my countings. Okay, so now that I have counted 100 white blood cells, I'm going to get those numbers specifically. So right now they're being recorded as a percentage, counted 100 white blood cells, and each white blood cell, like we talked about, is reported in a percentage. So you'll need to get the total white blood cell count, and you can either do that from a automated hematology analyzer, or if you send it out to a lab, you can get that reference lab back and look that up for the total white blood cell count. You'll need to make sure that it's in microliters. Some hematology analyzers will record numbers in liters, so if you do that, you'll need to convert it to microliters in order to have an accurate recording of your numbers. So let's just say that he's got a total of 6,000 white blood cells. What you're going to do is, I counted, let's see, that would be 61 neutrophils. So what I'm going to do is take 6,000 and divide it by, I'm sorry, not divide it, 6,000 times 0.61, because that would be 61%. And that gets me 3,660. So that would be the number of neutrophils that he has per that total 6,000 count. And you would do that again with for lymphocytes, monocytes, eosinophils, basophils that you've recorded until your number reflects what that white blood cell count is. My name is Faith Jordan. Student ID is 3630837. And today I'll be showing you how to do a PCV and TS test, TP test, for Clinical Pathology 1, Spring Semester 2024. So I have got my EDTA tube of blood here. I have got the clay packing, my microhematocrit tubes that are heparinized, and then my adapters for my centrifuge. So we do a PCV test, which is a packed cell volume of erythrocytes or red blood cells to help detect any underlying conditions. So if that PCV is elevated, there could be a pathologic condition. If it's low, it could be a pathologic condition like anemia. And if it's elevated, it just could be something as simple as dehydration, but we want to run this test to help better identify what could be going on. So a normal PCV for a canine is going to be 37 to 55%. So what I'm going to start by doing is I'm going to take out 2 of these tubes here, the microhematocrit tubes. And you know that they're microhematocrit heparinized because of the red ring. So I've got my tube EDTA blood here. I'm going to fill this about 3/4 full. Okay, I'm going to pack it 2 to 3 times in the clay. I'm going to get the second one out so that I can balance it in the centrifuge. You want to make sure that the centrifuge is always balanced. Now, I'm going to put one here. And I'm inserting the clay end down. Now we'll go over to the centrifuge. And I will put them in opposite of each other so that it is balanced. And the centrifuge is on, and this will spin for 2 to 5 minutes. So I will set it for 3. And then we will wait. Okay, so once I have taken my microhematocrit tubes out of the centrifuge, you'll see that there's some variation in the colors. So down where it's very dark, dense red, that is all of the red blood cells. They are the densest of all the blood cell types, and therefore they settle down here. In between there, the dark red and the lighter color fluid, there is something that's called the buffy coat, and that is white to gray in color, and that consists of white blood cells and platelets, and can be used to give you a estimated white blood cell count. And then above that, we have plasma. So the plasma should be clear. However, if it's red tinged, kind of like how this is, it could be a indicator of an underlying condition or that the sample was hemolyzed. It could be yellow, which is also known as icturic, and that could be indicative of an underlying condition that could be related to the liver. So in order to get the total packed cell volume, I've got a card here, and I'm going to take the bottom of the dark red where the red blood cells are all, and I want that to be at 0. And then I want the top of the plasma to be at 100. So I'm gonna move it along my card here until I've got it lined up. There we go. So my actual reading is gonna come from that top of the packed red blood cells. So as I look, I see that we are in between the 50 and 60%. And I know that those lines are a 2% increase. So we are just above the 52% line. So I would say that his PCV is a total of 53%. And since he is a canine, that is normal. Okay, so now that we've obtained our PCV, we're going to do our total serums test, which is measuring the total protein or plasma concentration. So You'll need your refractometer for that. And then you want to verify that your plasma itself is nice and clear. If it's yellow or icteric, that can be an indicator of an underlying condition. Or if it's kind of pink and blood tinged, that would mean that the sample is hemolyzed, or could mean that. And so it could lead you to false results with this. So like I said, nice and clear plasma, your refractometer to get that total plasma protein concentration. So you're going to break your microhematocrit tube just above the Buffy coat. And then you are going to invert it so that the broken end is not and that you're working with the plasma. So invert it completely. You don't want to tap it directly onto the prism glass itself because you could damage it. So we're going to fill the prism glass cover with plasma by capillary action. So now we're going to hold this up towards the light, and you're going to read where that light dark deviates. On my end, it is different between blue and white. And so holding it up to the light, I am reading, let's see, a 6.8, and this is from a canine. So 6.8, and that is going to be read in grams per deciliter. So I am reading that his plasma protein concentration is 6.8 grams per deciliter. If you want to come close, you can see that the sample is right there. So